Welcome back to Top 5 Best. If you liked this video, consider liking or even subscribing to us. Your click equals our smile. Diseases have plagued humanity for as long as existence has been around. Some diseases aren't deadly, and more or less just an annoyance, but then we have the deadliest diseases in the world. Number 10. Yellow fever. Yellow fever is caused by the yellow fever virus and spread via the bite of an infected female mosquito. Cases are typically reported in tropical areas of South America and Africa. Symptoms include fever, nausea, chills, back pain, headaches, and loss of appetite, but they generally lessen within 5 days. Yellow fever is responsible for over 30,000 deaths a year, almost entirely in Africa, but thankfully there is a vaccine. Survivors of the disease show no permanent organ damage, thankfully. Number 9. Cholera. Cholera is a bacterial infection of the small intestine caused by the Vibrio cholerae bacterium. It is spread via food and water that has been contaminated with human feces containing the bacterium. Symptoms generally start within a couple of hours to a week after exposure and include severe diarrhea, muscle cramps, and vomiting, often resulting in dehydration. Patients with severe cases may need to be rehydrated intravenously. Prevention involves sanitation and access to clean water. Cholera affects millions of people worldwide, mostly in underdeveloped countries, and causes around 100,000 deaths a year. Number 8. SARS. Severe Acute Respiratory Syndrome, or SARS, is a viral disease caused by the SARS coronavirus. Symptoms appear flu-like and include high fever, cough, and sore throat. Severe cases led to shortness of breath and either viral or bacterial pneumonia. There is no vaccine for SARS, and because it is caused by a virus, antibiotics are ineffective. Quarantine and isolation are the most effective means to stop its spread. SARS was first discovered in China in 2002 and later spread to over 37 countries. However, since that outbreak, no other cases have been reported. Number 7. Zika. Also known as Zika fever, is an infectious viral disease. It is hard to treat because patients afflicted with it often show no symptoms, which makes them the perfect carriers for the disease. Zika can either be spread through the bite of mosquitoes, transmitted sexually, or from pregnant mother to a fetus. Zika has not caused any fatalities. However, babies born to pregnant women who have contracted it have shown signs of microcephaly, or abnormal brain development, which can lead to intellectual disability, poor speech and motor functions, and abnormal facial features. There is no vaccine for Zika. Prevention involves decreasing mosquito populations in affected area and contraceptives. Number 6. Syphilis. Syphilis is a sexually transmitted disease caused by the bacterium Treponema pallidum. Symptoms vary based on the progression of the disease, which is divided into 4 stages. The first stage presents the appearance of a painless sore. The secondary stage presents the appearance of a rash, often on the mouth, palms of the hands, soles of the feet, mouth, or vagina. The third stage presents non-cancerous growths on the skin, as well as neurological or heart symptoms. The fourth stage includes latent syphilis, in which little to no symptoms appear for many years. It infects more than 300,000 people worldwide and results in over 100,000 deaths a year. Number 5. Meningitis. Meningitis refers to an inflammation of the membranes that protect the brain and spinal cord. The inflammation may be caused by viruses, bacteria, or other microorganisms. Symptoms include fever, vomiting, headache, neck stiffness, confusion, and sensitivity to light and sound. Immunization provides some protection against certain forms of meningitis, and antibiotics are also effective against other strains. Meningitis affects over 16 million people worldwide and results in over 300,000 deaths a year. With treatment, the mortality risk drops to less than 15%. Number 4. Tuberculosis. Tuberculosis is an infectious disease caused by the Mycobacterium tuberculosis bacterium. 90% of infections show no symptoms. When the disease is active, symptoms include a chronic cough with blood sputum, fever, and weight loss. It most often affects the lungs, but can also spread to other parts of the body. Active tuberculosis kills half of the patients that are infected by it, and is spread by active tuberculosis patients by coughing, speaking, or sneezing. Latent tuberculosis patients do not spread the disease. Treatment includes the use of multiple antibiotics over an extended period of time. There is also a vaccine for high-risk individuals. Number 3. Whooping cough. Whooping cough, also known as pertussis or 100-day cough, is caused by a bacterial infection that is highly contagious. Symptoms are similar to a common cold and includes fever, runny nose, and cough. The cough in particular becomes worse over time, with the patient enduring severe coughing fits. During these fits, the patients may cough so hard they can crack ribs. The coughing sometimes lasts for 10 weeks or more. A vaccine is available, and children are advised to receive 4 doses before the age of 2. For the non-vaccinated, treatment includes the use of antibiotics. It is estimated that over 16 million people a year are infected with whooping cough, and it is responsible for over 60,000 deaths a year, mainly in developing countries. Number 2. Ebola. Ebola is a lethal disease caused by the Ebola virus. Symptoms generally start within a few days of infection and include fever, sore throat, head and muscle aches, followed shortly thereafter by diarrhea, vomiting, rash, decreased liver and kidney function, and internal and external bleeding. The disease has a high mortality rate, killing half of those who contract it. The virus is spread through direct contact with bodily fluids, like blood. The virus may also lie dormant in patients who successfully recover from it. Doctors believe the disease is spread by fruit bats. Unfortunately, no specific treatment or vaccine is available. Number 1. Tetanus. Tetanus, also known as lockjaw, is a bacterial infection caused by the bacterium Clostridium. The bacteria produces toxins that interfere with muscle contractions. Symptoms include severe muscle spasms that begin in the jaw, thus lockjaw, and then progress throughout the rest of the body. The spasms last a few minutes at a time and generally happen 3 to 4 times a week. The spasms create bone fractures. In addition to the spasms, some patients also experience fever, headache, high blood pressure, and an elevated heart rate. Symptoms generally appear within 3 weeks of infection and can last for months. Tetanus is a 10% mortality rate and kills around 60,000 people annually. A tetanus vaccine is available and doctors recommend immunization. Remember everybody, stay safe, take your medicine normally, and just have a great day.